My name is Genevieve Onyanuna. I'm a student of a DMP student of Brandman University. Today's voiceover presentation is on choosing a theoretical concept and applying it to your CSP. My chosen theoretical concept is Baker's tidal model of mental health recovery and the relevance to my CSP. Overview of the theoretical model. Baker's tidal model of mental health recovery is a middle-range theory of nursing that can be used as the basis for interdisciplinary healthcare. This theory emphasizes psychiatric recovery through changing of thought process and perception. Changing of thought process is guided by the mental health provider that will result in a positive behavioral change. The main focus of this model is on helping individual patients create their own path to recovery at their own pace, letting the patient take active role in their recovery process by following strictly to their medication regimen. My CSP project. My CSP project is on reducing early readmission rate in adult patients 18 to 65 years of age diagnosed with schizophrenia. I intend to carry out this change by using weekly nurse practitioner home visit. Activities that are going to be carried out during this home visit include providing education on the importance of medication adherence, maintaining a compliance, and providing psychiatric health assessment based on Baker's model of psychiatric care. The relevance of this theoretical model to my CSP. Increase in readmission is as a result of discontinuity of psychiatric nurse care from inpatient to outpatient, which results in relapse and readmission. Now, having worked in psychiatric hospital for 7 years, I've had the privilege to see these patients being discharged, and within 2-3 weeks, just like that, within 2 weeks, they are back to the hospital. And when we interview them, we find out that most of them, the excuses is that, oh, I stopped taking my medication. So if there is adequate reinforcement and care, caring for these patients and reminding them, reinforcing the importance of medication adherence, and that would help them to comply. I mean, that would help them to to be up to date with their medication, letting them know the importance of medication adherence and guiding them through that. Okay, applying Baker's tidal model of care to my CSP is through the psychiatric nurse helping patients develop strategies for coping with his or her mental illness through adherence to medication regimen. And so it entails encouraging patients to learn from their past negative experience and creating positive change. It also includes engaging patients in relation to controlling and managing their distress through psychotherapy. Baker's model for care emphasizes individualized care, which will promote positive relationship between the psychiatric nurse practitioner and the patient, thereby building trust. Trust is a very good quality, an asset in psychiatry. In psychiatry, we need these patients to, we need to gain their trust. They need to know that they need to trust us. They need to know that we are there to protect them, because they are very fragile. They need to know that we are there to help them. And then we as nurses, we also need to provide care with empathy, knowing that these people, they are limited, they are limited, to help them and guide them through whatever they are through their illnesses. So change in patient's thoughts and pattern and behavior will ultimately lead to the patient to live a normal life, thereby decreasing early readmission rate. The aim of my CSP is to re-empower the patient and develop genuine collaborative approaches to patient care, which is in line with Baker's tidal model of care. The essence and the real entirety of this CSP is to encourage patients, to guide them, encourage them in living a positive life, making them stable, ensuring a stability, and and that way it prevents them from coming back to the hospital. That is all they need. That is the sure way to reduce readmission and prevent relapse. Thank you so much for listening to the short presentation. The next slide is my reference. Thank you.